Yeah, it was quite unexpected, but it's not totally surprising results. Majority of HER2-enriched subtype, as defined by the gene expression assay, is actually approximately about 60 to 75% of HER2-enriched subtype do have TP53 mutation, as shown by TCGA or my previous supervisor, Chuck Peru. So initially I was thinking it's probably just like a kind of association kind of game. But when we start to overlay this data with the proteomics data, particularly integrate the mutation with the protein data, actually some of these cases that actually have TP53 mutation, they actually have wild type TP53 protein expression. So this may suggest that although they have TP53 mutations, that doesn't mean that the TP53 protein not functioning. So this may suggest a potential if we are trying to evaluate TP53 as a biomarker in the ER positive as a cohort, we may need to start to think about looking at both the mutation and then the protein data. In the past, people have tried to detect TP53 protein by immunochemistry, but it's an assay that is not quite robust in telling wild type or loss of function. But now with the emerging kind of protein data, this could potentially help us to actually be a little bit more robust to detect this biomarker. So I think from the future, when we start to look at ER positive, HER2 positive cancer, just like ER positive, HER2 negative, intrinsic subtyping as defined by luminal A, luminal B, HER2 enriched and basal line, we should really be a little bit more aware to actually do this subtyping on these ER positive tumors, because we consistently see data from our study or other studies that HER2 enriched and basal like among the ER positive breast cancer overall, rather the HER2 positive, HER2 negative, just to perform and respond to endocrine therapy very differently. So we should really start to thinking about this as a basic first. So we have talked a lot about just now with our work on the tissue-based assays, and I was honored to be able to moderate the prognostic and predictive value of ctDNA session yesterday. There was a lot of fantastic presentation from different groups to try to evaluate the clinical utility of ctDNA in the context of moving in terms of in the more early breast cancer high-risk group. There was a lot of interesting cases demonstrating that tumor-informed ctDNA could help in terms of disease monitoring or kind of a prognostic value. And also particularly there were two studies that start to also move a little bit one step further by looking at the epigenomics and fragmentomics from the study. So that seems to suggest that ctDNA or plasma-based assay have a lot of potential as well. So I was particularly excited from that session.